The views and opinions expressed in the following program are those of the participants and do not necessarily reflect those of KSMQ Public Service Media Incorporated or its assigns.
Tonight on Health Connections, we're talking about pregnancy at any age, what risks there are, what modern medicines will help with, and much more. Stay tuned. You're watching Health Connections. Pregnancy causes many changes in a woman's body. What happens when these changes are accompanied by another risk, such as vitamin deficiency, HIV, or cancer? Dr. Kristi Boldt, obstetrician at Mayo Clinic, was kind enough to meet with us earlier today to discuss high-risk pregnancies, including those of young adolescent women. Take a look. I can only imagine the patient scenarios you must have seen. So tonight we're going to be talking about some high-risk pregnancies and concurrent conditions that go together. Just wanted your input on some of these things. For example, patients that come into you that have severe vitamin deficiency before they are pregnant, are you seeing more of that now than in the past?
I really think we are, for a number of reasons. One, unfortunately, our population is getting a lot bigger, and they're not eating as nutritionally well as they could with fast food and whatnot. The other thing we're seeing is a lot of the patients that have had the bypass, various types of bypass surgery to let them lose weight, those patients are now getting pregnant, and they're at exceedingly high risk of having problems with vitamin D deficiency, in particular vitamin B12, calcium, and it's really starting to be a problem in some of our patient populations.
And do you think it's that we've always been vitamin deficient? I know you're talking about eating nutritionally, but to a certain degree, or is it that we're more aware now, prior to being pregnant, that we are vitamin deficient because we've been told?
I don't think we're being told, even in pregnancy, that we're vitamin deficient, because you know, we all take, well, not we, I'm not pregnant, but we all take a recommended vitamin supplement during pregnancy, but I think it's just the whole way our population has shifted to be less nutritionally conscientious in what we eat. Some people are extraordinarily good, but others, with all the fast foods out there. One of the things is, with the vitamin D in particular, is that being in a more northern climate, we get a lot of our vitamin D from the sun. So of course, in the wintertime, we're not going to see that as much. And in the old days, it used to be a real problem because the women that were pregnant would have a vitamin D deficiency and then end up with rickets and have a very small pelvis and not be able to deliver. We're not seeing that anymore, but we are still seeing people with probably low levels of vitamin D.
And that's because we have prenatal vitamins. Is that why we're not seeing that anymore?
Well,
or that's
no,
more...
I think we're having fortified foods. So vitamin D is in a lot of fortified cereals, milk and stuff. Sure. And so we can just eat better than we used to.
In the case of mothers that are calcium deficient prior to pregnancy, and then maybe that wears on them a little bit while they are pregnant, how does this affect the bone development in the fetus?
Well, you know, unless it's an extraordinary case, it isn't really a major problem at this point.
Good to know. And I understand that some vitamin D deficiency is common in pregnancy, and I think they say that salmon and other fishes are your main dietary source for that. What can you do in pregnancy, being that you can't eat fishes? Is that correct?
Well, you can eat fish in pregnancy, but we want you to limit it because we worry about the mercury in fish. So in particular, we stay away from freshwater fish, so the locally caught fish, and it's best to go for deep sea fish. So the best sources of vitamin D are usually in things like salmon, cod. Okay, those are usually pretty low in mercury, so those are great fish to have, but then we recommend that you have no more than 2 servings a week maximum. So that limits your sources of getting it from fish. So you have to do the sunshine, the fortified foods like milk and cereals, and then you can also, some eggs, all eggs have some vitamin D in it as well.
Oh, that's good to know. And we talked about how, I was wondering if maybe different people in different climates are not suffering as much from vitamin D deficiency even in pregnancy. Have you seen any research on that, or do you know anything?
There is research. Okay. We know that in northern climates, the darker skinned people don't do as well because they don't absorb the vitamin D as well from the sun. And so, you know, we haven't specific research to show that pregnant people don't do so well if they're not getting enough sunlight.
But do pregnant people in the South do better? Because they have more sun? Or?
But they have other problems then.
Okay,
so,
I see. So it's always something. Let's talk a little bit about HIV and pregnancy. I know maybe we don't deal with it so much in this region of the country, but what implications are they facing?
You know, I've been working with people with HIV for a number of years, and we're so fortunate in North America that we have access to treatment because things have really resolved or improved over the last few years for ladies with HIV. We do like to test everyone that becomes pregnant for HIV, even if they don't think they're at risk for it, because there's so much we can do in North America now to prevent the baby from getting HIV and to improve the quality of life of anyone with HIV. When I'm from Canada originally, and when I was working in Canada initially with HIV, we didn't have any treatments, and so it was a high number of babies that would get it. The mums didn't do well in the long run, but now with the use of medication and good medical supportive care during pregnancy, we can pretty well minimize the risk of the baby getting it at all or the disease progressing in mom, which is great.
And are these treatments available in other countries or not yet?
Yeah, and that's the problem. We're lucky in this part of America that we don't see too much HIV. Right in Rochester, there's a lot of HIV through the rest of the states in North America, but what worries me is more in the world how much HIV there is, and these are in countries that don't have the resources, don't have the methods of treating people. We can't even test people to see if they're at risk. Even if you test them, then you can't offer them the drugs often because they are so expensive. And so it's a real problem in Africa, in some of the other Asian countries.
Yes. Even if the fetus is not HIV positive, or the baby upon birth, is that child more likely to have health risks later in life just having had an HIV positive mother?
Well, that's interesting because it's sort of how did the mother get HIV? Is she one of those people that unfortunately is at high risk because of things like substance abuse? Okay, or there's other people that get blood transfusions because of medical conditions that are making them more susceptible to other problems. So it's a really complicated question.
So it maybe depends more on the mother's lifestyle up until that
lifestyle
point.
And how did she get HIV? Was it a medical condition in herself that made her susceptible to it? So.
And similarly, we have mothers who certainly have been through cancer treatments and have had cancer and then now are pregnant. How does that affect the baby, or does it?
There's some cancer that can actually be spread to the fetus through the placenta, for example, melanomas, so that's always a worry. We're seeing more people who are cancer survivors that are pregnant because more people tend to be surviving with the new medications we have, but it really does depend on the type of cancer, whether it's going to affect mom or not, or baby or not. One of the cancers we see a lot in pregnancy are mothers that have, for example, thyroid cancer, and often with thyroid cancer, you can put it into remission, and the pregnancies go very well, but we have to follow them a little more closely, make sure their thyroid is being treated appropriately, because if it isn't, we could cause problems for the babies.
Okay. Oh, that's interesting. I'm going to totally switch gears here and talk a little bit about birth control. We've heard a lot about long-acting reversible contraceptive devices such as IUDs and also contraceptive implants. What is your feeling on contraceptive implants and the risks associated with that?
I think there's a lot of good things about the implants. over the years they've had a bad name associated with them, but we have a new one out that is quite good for certain populations. It's probably good for a teenager who isn't sort of as good at taking medication as an older person might be. Other people would be people on certain medications where oral medications would interact with their drugs, would be another person. But there are some great people, or great situations where the implants are wonderful. The IUDs are great. We're using them more and more. They're really popular in Europe, and with the right person, the IUDs can be just the best type of contraception, because they really, once they're in, you don't have to think about them except to check once a month to make sure they're still in the right place, which you can do easily by just basically checking in your vagina. And so they're a great idea as well.
So what would you recommend? So you said maybe for adolescents or teens, or that it might be, that maybe a contraceptive implant would be a good. What would you recommend for mothers who are in between pregnancies? What's the most common or most popular contraceptive option, or what would you most recommend?
It sort of depends on the situation. Unfortunately, we're seeing a lot more teen pregnancies, and so you might want to choose something that is very easy for the teen to use, something like medical injection every 3 months.
Okay.
Okay.
Mm-hmm.
The IUD, often we don't recommend it in teenagers just because in the past it has been associated with infections. We're not seeing that as much anymore, but it's always a concern. Depends too, is the mother breastfeeding? Because if she's breastfeeding, we might not want to put her on a regular birth control pill, because sometimes that can reduce the amount of breast milk that you make, and that could be a problem. So there's all sorts of factors involved, but
whereas the injection would not have that effect.
It shouldn't affect the breast milk. We do have a pill we can give people. We call it the mini pill. There's various trade names, of course, for it, where it's a progesterone-only pill, and that is very good if you're breastfeeding.
Okay.
But it isn't as good a birth control pill if you're not breastfeeding. Breastfeeding confers just a little bit protection against pregnancy, but if you're not breastfeeding,
it's not as safe.
It's not as safe. So I definitely wouldn't just breastfeed for contraception. It doesn't work at all.
Right. Would you recommend the ring or any sort of device like that for in-between pregnancies?
Well, you know, it's a great idea. We don't routinely suggest it to moms that are immediately postpartum or who are breastfeeding, because it's sort of like the pill in that there can be higher levels of hormones in the blood, and that might affect the breast milk.
Okay.
But if they're not breastfeeding or they're spacing their periods, the ring is a great choice. And a lot of people really like it once they get over the fact they're sticking something in there. But again, it's used in Europe quite a bit, and the women over there are very happy with it.
So that would maybe be recommended for people who think they're finished having children. Maybe the ring or the IUD would be a good long-term choice.
Well, the ring isn't really long-term. It's
okay,
more like
wondering.
the pill. You have to consistently use it.
Okay.
Whereas the IUD, there's a 5-year IUD, a 10-year IUD.
Sure.
It's perfect for those people that really want to space their kids or are done.
Mm-hmm.
Or even if they only want to space for 2 years, even though these devices are good for 5 or 10 years, they're really easily taken out.
So the ring is more of a temporary.
Yeah, the ring is something you have to think about. You do have to maintain it.
And what about environmental toxins? How do those affect pregnant mothers? I've heard a lot about it, but what do we know?
Do you know, I don't think we know that much, but just thinking about it, in our whole lifestyle, it's got to be important. You know, we're seeing all these additives in food, we're seeing all these pollutants in the environment. I think it must be affecting all of us,
right.
And whether we're pregnant or not. And what the absolute problem might be to our infants, I don't know, but we are seeing more of a number of conditions. Is this related to our lifestyle? Is this related to the environment? I don't know. We're seeing more, for example, autism. What's that related to? Is it something in our environment, or who knows? You know, there are various theories out there, but we're also seeing a lot more diabetes. That's related to our dietary intake, which is, you know, again, environment. And so I think it's affecting us all around, and probably affecting our pregnancies as well.
That's good to know. Just one other question here, one other category I'd like to touch on: age. What about mothers who are very, very young when they're pregnant? What kind of risks does that pose for their bodies as far as carrying the pregnancy, as far as labor goes?
Well, first of all, with the very young women, and we are seeing more very young teenagers having pregnancies recently in this area as well, some as young as 12. Where I've worked before, I've seen them even younger. You know, just think of it, the strain on the body. One, a lot of these kids are maybe not eating as well, maybe they're into other things. Sometimes the reason why these young women get pregnant is because maybe they're already into drugs, or just sometimes it's a bad social situation, sometimes it just happens. So there's a lot of a really complex picture going on here, but when you just look at their bodies, they're not completely developed yet. You know, they've got to have smaller pelvises, a lot of them. You really worry about how they're going to carry the babies. So, you know, they're at a little bit increased risk of things like premature labor, poor nutrition, preeclampsia or elevated blood pressure in pregnancy is far more common in these young people. So there's a lot of different issues we worry about with them.
If you had one thing to tell teens and younger women about pregnancy or prevention, what would it be besides the obvious abstinence? What would it be? I mean, what part of the education piece are we missing here that these children are getting pregnant at 12? I know that's not an easy answer, but what's your recommendation once you see a patient like that? What do you tell them to say? Like, listen, you really need to be safe. What do you say?
Well, it's not an easy answer, obviously, because it's not only the pregnancy part of things that we worry about, but the HIV out there. A lot of these kids are having unprotected sex, and I have seen, not in this region, but I've seen in other areas. I've worked HIV in teenagers, early teenagers, that they got just because of sex with a high school buddy, and that's worrisome. And then the pregnancies, of course, are very worrisome, but it's really hard to tell a young person anything.
Okay.
You know, so I don't know what approach to do.
So it's the invincible kind of...
Exactly.
So we just have to keep educating and keep just preaching about what options are out there.
Well, the key thing is not to preach, I think.
Not to preach, okay.
So to get
Be a friend.
well, and we don't want to do that either. So it's really complex. How do we do it? So I think we have to get the teenagers on board and get them talking amongst themselves and teaching each other.
Okay. But do you think they're aware of the risks?
I think that they're invincible. I really think that some of them are very sensible, but there's others that know the risks but just think it will never happen to them. Mm-hmm.
And one more aspect of the age question here. What about premenopausal women who become pregnant, whether it's accidentally or purposefully? What types of, besides the risks to the baby as far as Down syndrome and those things that we already know, what other risks are they more at risk for breast cancer, cervical cancer? Are these things accompanied with that, or what are your feelings on
the
that?
Cancers, we don't think pregnancy increases their risk of the various cancers. It's more their age group. But the risks associated with the later pregnancies are a much higher risk of miscarriage, a much higher risk of things like developing diabetes during pregnancy, premature labor, high blood pressure during pregnancy, small babies. There's a lot more risks involved.
What about postpartum risks? If you're a 50-year-old woman, you have a baby. Are they different from if you're a 50-year-old woman who had a baby when she was 35?
Well, you know, there's pros and cons, because when you're young, like I'm thinking more 20, you have the energy to look after a baby,
Absolutely.
but maybe not the wisdom and the patience, whereas when you're older, you have the patience, but then you get tired out, and so maybe the patience is gone. And so it's a complex picture, but...
So that's a behavioral aspect, but there is no concrete evidence to show that you have any more health complications being that you got pregnant late in life?
Well, I think during pregnancy, definitely. So if you develop hypertension in pregnancy or high blood pressure in pregnancy, you're more likely for it to continue on. The diabetes, you're more likely for it to continue on.
Okay,
calcium in any pregnancy is decreased in your body, even though you do the increased intake when you're pregnant. But all pregnant women get a little bit of bone thinning during pregnancy. So when you're older and get pregnant, this is going to happen too. So is this going to increase your risk when you're older and pregnant of getting osteoporosis down the line? I don't know. I mean,
it's possible. Well, thank you very much for answering my questions today. Appreciate you taking the time to meet with us. To continue this conversation, we have with us tonight Joanne Rasmussen, Center Coordinator for Rachel's Hope of Austin. Thanks for joining us.
Thanks for having me.
What is Rachel's Hope? Just give us a little idea of what you do there.
Well, we're a faith-based, pro-life, caring pregnancy center. And we care about all people. We are not a medical center, and we are not licensed counselors, but we have been trained to peer advise.
Okay, and who's your most common client that you see?
Well, we have people anywhere from 14 years old to, 25. But we also have people that are 35 whose husbands have left them, or somebody who has had horrible illnesses and they are needing help. Or we have the 55-year-old grandma who just got her foster children, or her grandchildren, and she is going to take care of them, and she has no clothing or diapers for these children, and so she is going to be taking care of them. So we have anywhere from 14 to 55.
And like a 14-year-old coming to see you, what service can you provide that 14-year-old?
Okay, we do provide them with pregnancy tests, because usually they are really concerned about that. And then we peer advise them about if they have a positive test, we talk to them about the things that we can provide, and adoption referral if they would be interested in that. Or if the test is negative, then we talk to them about where they want their life to go, and what kind of things they can do to be safe, and how to protect themselves in the future.
And when you say safe, when we're talking about safe sex practices, you're not only referring to protection against pregnancy, but also against HIV and STDs and other things. How do you advise them?
Well, I have this brochure, and it says, "How at risk are you?" And I usually show this to a lot of them, and I say, you know, the thing is how many sexual partners have you had? If you have had 6 sexual partners, and they have had some, you can be exposed to 63 people and all their diseases. And so I try to impress upon them how risky this kind of sexual experience is, and hopefully they can understand that this is something that they don't want to be doing to their bodies. We also talk to them about how condoms are only 15% safe, that this is not the safest way to protect yourself, and that even a pinhole in a condom can cause you to have the HIV or the AIDS virus. And so the people that I care about the most, I don't want them to have that. And I don't want them to have this problem of something not working and not taking care of them. We have heard of a person, know of a person that had 3 different types of contraceptives that they used, and she still got pregnant.
Oh.
And so whenever I talk to them, I talk to those people about that, and I say, so if 3 kinds of contraceptives failed, what is the only way for you to be sure that you're not going to be a mother or a father? And they say, oh, not to have sex. And so this is where we lead them and try to help them understand that there are people are telling them that there is a way to have safe sex. But if you really want your life to be protected and not to have that deadly disease of AIDS, or have a baby that you really are not ready to expect, then you need to abstain from sex.
And would you say that most of your clients are aware of the financial implications and the general lifestyle change that parenthood imposes? I mean, are they ready for that? Are they aware of those changes and how financially sound they need to be to bring a child into their lives?
No, because whenever you talk to them, you ask them, well, now, if you're going to have a baby, are you ready to buy those diapers? Are you ready to buy that formula? Are you ready to put those clothes on the children? Do you have a job? Well, no. Well, then how are you going to provide for this child? And so we do want them to think beforehand that every time I want to have sex, I could. Contraceptives don't always work. They fail. And we see a lot of people that have had contraceptives fail. So if they don't want to be and they are not ready to be parents, then they need to think before they have sex.
Absolutely. So prevention is the key. But once you're in this situation, how can the community help you? What kind of resources do you offer that we could help out with? What could we provide?
Okay, we do not receive any funding from the government. So, and that's so that we can help give out Bibles and things like that. But we can use financial support. We can use volunteers. We definitely use volunteers. And we need a Spanish-speaking volunteer because many of our clients now are Spanish-speaking too. And we can use all kinds of material goods. Anything that a baby uses, we need. And so you
such
can
as
just contact
clothing,
us.
diapers, those sorts of things.
Diapers, shampoo, baby wash, lotion, anything like that. We can use all of those things, and that will greatly help us out. We are also asking anybody that's had a garage sale lately, if you haven't gotten rid of all of your things and you have some leftovers that are 0 to size 2, that's as big as we go, then we can use those things.
Well, it's certainly good to know that a service like that is available. And I hope that you receive some community help, and I hope that you continue doing the things you're doing. We thank you for that. Thanks for being here with us, Joanne.
Thank you so much for having me.
Thank you for joining us tonight. Join us next week as we discuss childhood obesity and family nutrition. Thanks, and have a good night.